So, what does this mean, a booster shot? What does it mean for you or I or anyone who's been vaccinated, and who's first in line?
So the booster shots are an opportunity for all of us to get our immune systems even more ready to fight the virus should we become reinfected. So what happens when you receive the initial dose of the vaccination is that you create antibodies. And over time, those antibodies wane. So if you get a booster, you increase the presence of antibodies in your body that are available much more readily. Here's my metaphor for it. If you imagine you're doing a 100-meter race, right? And the person who gets out of the block fastest is able to get to the line the quickest. That's the same idea here. If you get a booster, you're going to have an immune reaction that's much more rapid and much more quick than if you don't have a booster. So it will fight the virus in a shorter amount of time than if you don't actually have the booster. So it's beneficial to controlling the spread in your body.
Okay, so who would be first among us all to get this booster shot? Is there sort of a list?
So the CDC has recommended first and foremost immunocompromised people whose immune systems are already ravaged because of some kind of other disease. And then what will happen over time is that the rest of us, the Biden administration has said the rest of us will be announced over the course of the next month or so as being able to receive it. My expectation is that in the fall, the majority of the American public will be available for the booster vaccination, and we should all do it.
Yeah. Okay. So let me ask you, my favorite topic with you is always public messaging about this. Up until now, federal officials weren't necessarily saying that this would be a must. July 4th, not that long ago, the president was talking about declaring our independence from the virus. I mean, is this just an overall shift also because the nation has sort of lost the control that we've had on the pandemic? Or is it that Delta is just that much more able to evade the vaccines?
Brianna, and it's not just Delta. I mean, ultimately, it's going to be like, as a Greek, I'll read the whole alphabet to you: Omicron, or Pi, or Rho, or Sigma, or some variant down the line that's going to be even worse than Delta. So I think the opportunity right now is to get the booster in there to control the virus, to build up our immune system, so that if an even more powerful variant comes along, that we're able to manage it. What we've learned in the last 18 months is the following: we have to be nimble. Right? We have to be willing to change. We're learning new things every day. So vaccination good, vaccination with booster better.
Let me switch gears very quickly. How concerned are you heading into the school year? We have yet to see an authorization. We've yet to see some of the data. We're waiting for that in September for the vaccine for those children under the age of 12. We know that pediatric hospitalizations have been rising across the country, although New Jersey's faring a bit better. How concerned are you heading into the fall?
If I had a child right now and that child was going back to school, I would be alarmed. I would be alarmed for two main reasons. Number one, there is, as you say, a part of the population of young children under 12 who are not able to be vaccinated yet, so are highly susceptible. We know that the rates of infection are going up among children, and there is this huge anti-mask effort for schools. So, which I don't completely understand, and maybe there's some illogic to me. But if I were a parent, and as many people are who are listening who are parents, you want to do everything to protect your child, right? And protecting your child means getting your child vaccinated and having your child wear a mask in school. It's not going to cause the psychological damage that people claim it's going to cause. COVID may create much worse damage, including death.
Dr. Perry Halkitis, always good to talk to you. Thanks so much for your insight today.
Thank you.